My name is Dr. Kushagra Verma. I'm an orthopedic spine surgeon. I trained in complex spine, but I'm a specialist in both complex spine and minimally invasive. I went to medical school at NYU. When I was at NYU, I had the privilege of lining up with spine surgeons that did very complex spine work, and I was even taken abroad at that time to do medical outreach work in Ghana, and I've gone to other countries since that time, and it really got me quite excited about orthopedic spine surgery. Following that experience at NYU, I went to the Rothman Institute at Thomas Jefferson University in Philadelphia. My fellowship was in complex spine surgery at UCSF in San Francisco, and for 2 years I was a professor at the University of Washington in Seattle. After that, I transitioned to private practice in Los Angeles, really with the vision of providing concierge-level care to patients and doing it in a very high-quality way with evidence-based spine surgery. Probably my biggest surgical accomplishment is a case that I did last year abroad. It was a patient in Africa that had neurofibromatosis and 160-degree complex scoliosis, where the spinal cord was completely kinked in a very tenuous way, and that patient was losing function. And in that situation, we had to take a very complex spine and straighten it out while removing bone around the spinal cord safely away from the spinal cord, and then stabilize everything and straighten out the patient's spine. I think what sets me apart as a surgeon is our concierge approach, the way we treat patients, the way our office is set up, and the way we take time with our patients. Also, what sets us apart is the surgical techniques that we do. They're cutting edge, they're minimally invasive, and our outcomes are excellent. We have an entire research division in our practice studying the outcomes of both patients treated at a surgical center and also patients treated with very complex pathology. I think part of what makes our practice good is not even me. It's the staff that has been with me for several years that work tirelessly to help support our patients so that if there's a question or a medication that needs refilling, we're always there to help. And I think it's that combination of the surgeon well supported by good staff that makes our practice exceptional. So I've decided to collaborate with DISC because they share a common vision with our practice. I believe in concierge level care, pushing the envelope to do things more minimally invasive, and I think a revolution in spine surgery is the outpatient revolution, where more and more patients are being treated in an outpatient setting. Our practice is focused on delivering concierge level care to patients and trying to find the most minimally invasive solutions to patients' problems. We really believe in a non-surgical approach as our first approach, and then really pursuing surgery as our last approach. Sometimes problems can't be fixed without surgery, and then we really look to find a more personalized approach that we can use for our patients.